Statistics gathered from the Victoria Hospital over a decade indicate that gastrointestinal cancers or digestive cancers have now surpassed in prevalence prostate and breast cancer. Gastrointestinal cancers include cancers of the esophagus, gallbladder, liver, pancreas, stomach, small intestine, bowel, which includes the large intestine or colon, and rectum, and anus. This revelation came from consultant oncologist at the Victoria Hospital, Dr. Owen Gabriel, who presented a paper at the international meeting of the African Caribbean Cancer Consortium in Martinique in 2013. The data from the Victoria Hospital illustrated the changing trends in cancer prevalence and incidence in St. Lucia.
We'd like to be able to extend the coverage of a population-based registry that would give us a better idea of what's happening, let's say, in the north, the south, and the different parts of the island.
Though some types of cancers run in certain families, most cancers are a result of lifestyle factors such as tobacco and alcohol use, poor diet, physical inactivity, certain types of infections, and environmental exposure to various types of chemicals and radiation. Dr. Gabriel added that in urban areas there is a prevalence of gastrointestinal cancers as there is a tendency towards more fast foods.
In our case, which is not proven, but certainly one has to consider the impact of the industrial use of agricultural products in our banana industry, in our agricultural industry, that would go into our ecosystem, get into the soil, the water, the food that we consume, and eventually cause those kinds of mutations in the cells of our body that would lead to cancer eventually.
The consultant oncologist stressed that the mainstay of cancer control is prevention, and a third of most cancers are preventable through lifestyle changes.
Prevention means that you first identify which factors are common in producing those cancers and try to avoid them. And as we've identified earlier on, lifestyle is a major factor. So if you, and certainly it suggests that maybe a third of all cancers are preventable, and a lot has to do with your ability to prevent, the smoking habit, avoiding alcohol, having a healthy diet, exercising, and so on, and trying to live a healthy lifestyle.
In reference to the eminent move of the Victoria Hospital to the Owen King EU Hospital, Dr. Gabriel made it clear that the new hospital should not be viewed as the panacea for all our medical problems.
One should not expect the whole health profile to change in a short space of time. We need to address our basic health issues, some of which we have discussed here, which would be prevention and control at the primary level of care. And once we're able to do these things, what you will have as a ripple effect is that you have fewer patients developing diseases, number one. You also have the ability to diagnose our diseases in an earlier stage, and therefore the need for full-blown treatment, all modalities of treatment will become reduced, and therefore the cost of healthcare will be reduced. And in the end, what we will have is a better outcome for everybody else.
Dr. Gabriel pointed out the important role churches, youth groups, mass organizations, and NGOs should play in creating a culture of health consciousness, prevention, and control of diseases. From the Ministry of Health and Wellness, I am Glenn Simon reporting.